So we're really trying to embrace the realities of the changing dynamics in both healthcare and in education, understanding that the skills needed by someone who's leaving school right now and now going into the future of health really need to think differently and be educated differently. And as we're doing that, we're really reimagining what education needs to look like to provide not just people who are competent at caregiving, but also competent at navigating dynamic changes around the integration of AI, technology, but fundamentally bringing down to what we know about healthcare, which is that it's a human-to-human connection experience that we want to make sure our students are more than ready to navigate. One of the things we're really looking at is we're trying to lean into the future of health and healthcare education by owning up to the fact that higher education has oftentimes been far too focused on facts and figures and preparing students for a world where they had to be the content experts. And we're now moving towards really rethinking what education needs to be, thinking much more, and as we launch this initiative around humanics, about how we can embrace human literacy at the core of the educational experience for our students. So thinking about the human in the middle of an AI and digitally connected universe is something that we feel will make our students, as future healthcare leaders, more than ready to be prepared to navigate, and more importantly, really being, I would say, AI ready and integrated, but also not worrying about being displaced by the technology, but rather to be able to enhance the technology in clinical care. So a lot of what we're really thinking about in the day-to-day educational model is leaning more into students' creativity, their empathy, their communication skills, their ability to be critical thinkers, but also to be able to embrace dynamic conditions that are always changing. So rather than thinking only about distributing facts to students and memorizing the Krebs cycle or memorizing a whole host of drug interactions, we want to make sure that students rather know how to pull those facts from the universe of facts that are abundant in their lives, but more importantly, how to use them to dynamically deliver high quality care to individuals, many of whom have a story and a background that makes that culturally relevant care component critically important to affecting outcomes in a very, very positive way. Because I do believe that if we want people who are truly quote unquote bedside manner ready, and really the physicians that we would want to go to, the nurses we would want to be cared for by, I think we need to make sure that the skills that students are leaving with make them more than ready to be those leaders who are the ones that can impact lives, not just clinically, but compassionately, empathically, and fundamentally in a personal or an interpersonal way.